Hello and welcome. If you're a parent who's worried that your child might be struggling with an eating disorder, you are absolutely in the right place. We're going to walk through a really clear guide to understanding anorexia nervosa, and it's all designed to help you, the parent, feel more confident in how to support your child.
Seeing your child have a hard time with food and weight, it's just one of the toughest things to watch. It's so easy to feel lost or scared or even confused about what to do next. And you know what? That's completely normal. But I want to assure you there is a path forward. There are steps you can take.
So that's what we're going to do right now. We're going to break it all down into a simple, clear path. We'll cover what this condition actually is, how it's diagnosed, and maybe most importantly, how you are a truly essential part of the solution on their journey back to health.
Okay, so first things first. What exactly is anorexia nervosa? Let's get the clinical definition straight, because that really helps us separate the illness from all the myths out there about just, regular dieting or body image.
Now, this definition is so important. We're not just talking about someone wanting to be thinner. Anorexia is a really serious and complex mental illness. It's driven by a distorted perception, like what they see in the mirror is literally not what the rest of the world sees, and it's fueled by this powerful, all-consuming fear of gaining weight.
So when a doctor makes a diagnosis, they're looking for three main things. First, restricting food to the point where it leads to a really low body weight. Second, that intense fear we just mentioned. And third, this is a big one, a real disturbance in how they see their own body, which often means they just don't see how serious the situation really is.
It's also really helpful to know that anorexia isn't a one-size-fits-all thing. It can show up in a couple of different ways. You've got the restricting type, or weight loss comes from things like dieting or overexercising, but then you also have the binge eating/purging type, which involves episodes of binging and then purging. Knowing both patterns exist is really key.
Okay, so you're concerned, you've picked up the phone and made an appointment. What's actually going to happen next? Let's walk through what the diagnostic process looks like, just so you feel a little more prepared.
The very first step is going to be a long, thorough conversation. The doctor needs the full picture, so they're going to ask about everything. Your child's weight history, their eating habits, how they feel about their body. And yeah, they will probably ask about the family environment, but please know, this isn't about placing blame. It's just about understanding the entire support system. After the talk, there's going to be a physical exam. Here, the doctor is basically a detective, looking for the physical clues that the body gives off when it's malnourished. This can be things like getting dizzy when they stand up, or a fast heart rate, or even the body growing this fine, soft hair called lanugo, which is its desperate attempt to stay warm. These are all red flags that the body is under serious stress.
And finally, you can probably expect some lab work, like blood and urine tests. This part is absolutely crucial. It's how the doctors get to look under the hood and see the internal impact of the disorder, things like dangerous electrolyte imbalances or major vitamin deficiencies. This is all about making sure your child is physically safe right now.
All right, we've now come to what I believe is the most important part of this whole discussion, especially for you as a parent. You are not a bystander in this. You are a critical, active, vital part of the solution.
Just let that sink in for a moment. This comes directly from the experts, from the clinical guidelines. They couldn't be clearer about this. When it comes to kids and teens, family involvement isn't just a nice idea. It is absolutely essential for any real, lasting recovery.
So what does that look like? Well, one of the most effective approaches is a type of family therapy called the Maudsley method. And what's so amazing about it is that it doesn't just involve you, it actually trains and empowers you, the parents, to take the lead on your child's nutritional recovery, right there at home.
And beyond formal therapy, your support in these day-to-day things is just massive. We're talking about working with a dietitian, helping to limit exercise that gets in the way of weight gain, and even simple things like providing warmth with a blanket or a warm room, which can actually help ease anxiety. The core idea here is that you have to fix the nutrition first. Why? Because a brain that's starved of energy just can't do the hard work of psychological therapy.
Okay, I know we've covered a ton of ground, so let's bring it all together. What are the key steps? Let's boil this all down into a clear path forward for you. Here it is, your action plan. First, get that complete medical and psychiatric assessment. Second, insist, and I mean insist, on being part of the treatment team. Third, make nutrition the absolute #1 priority. And please remember this last one. You are not to blame. This is a complex illness, not a parenting failure.
If you walk away with just one thing today, I hope it's this. Acting early gives your child the absolute best possible chance at a full recovery. You know your child better than anyone on this planet. Trust your gut,
Take that next step and never, ever forget that you are their most important ally on this journey.